Doc on the Run. We help injured runners run.
Today on the Doc on the Run podcast, we're talking about the marathon method of injury recovery. All right, now today we're talking about the marathon method of injury recovery. And this is a thing I came up with when I actually was thinking about this, about what I do differently with runners now that I've been for about a decade basically focusing just on injured runners. Like, what do I do differently than when I had a normal practice where I saw kind of everybody with any kind of foot problem? Well, it's really simple. Let's think about what happens when you decide to run a marathon. Nobody just wakes up and says, I think I'm going to run a marathon today. It doesn't work that way. What usually happens is you have something that kind of triggers your desire to actually run a marathon. Maybe you watch an inspiring movie about a marathon runner. Maybe you hear some kind of story from one of your friends who did a marathon, lost a bunch of weight, they got fit, they set some huge goal, and they suggest you should run a marathon. Or maybe you read some kind of uplifting story about someone who overcame incredible odds to actually complete their goal of running a marathon. Well, either way, we all know it's really kind of a big goal. We know it's inspirational, and you decide that you want to do a marathon. So what do? Well, you don't just show up at a marathon. You don't just go down there because the Houston Marathon is starting or CIM is this weekend and get your number and see if you can do it. It all starts with some little inspiration and some spark that actually encourages you and kicks you into action. But before you run off to sign up for the marathon, what do? Well, you have this kind of vague idea. Okay, running a marathon sounded like a good idea because Mary told me so, and I think I should try to do it. But what do? Do you train? Do you buy a new book about how to run marathons? Do you go get a new sports bra that's going to decrease chafing over 26.2 miles? Do you get a new pair of running shoes? Do you hire a coach? No, you don't do any of those things. You don't do any of the action steps that you would normally take in training and completion of that marathon. So as soon as you sign up for that marathon, what do? Then you start to get into motion, right? You do something. So you sign up for the event, you take a deep breath, you think you're crazy, maybe you're not, but you know you have to do something. So you go for your first run. You take step one. You actually go out, maybe you walk a mile, maybe you run. But you go and you do something, and that suddenly sets everything in motion. That first little step of first taking action after you sign up for that marathon. Then you get into momentum. So you take this step, you sign up, and then everything changes. You don't just sit around thinking about it. You know you've got a deadline, and so you start taking action. You go get some new running shoes, you get some socks, you get some gear, maybe even get a GPS watch. You hire a coach, you pick out a training plan, you read a book on running a marathon. You start to do all this stuff that builds on itself very quickly, so you actually start to become very fit and prepare for your marathon. Now, this is the same thing. Everybody that I talk to who's an injured runner, I think about all the stuff that actually makes them heal fast or makes them heal slow. And there really are two differences about this, because I was just having a talk with somebody who was, asking me, what is this difference between runners who recover fast and those who recover slow? And there are two. Those two things are really simple. When they get started and when they get in motion, the runners who are sitting there listening to podcasts and watching YouTube videos and they know they're injured and they have all this conflicting advice that confuses them, they don't do anything. They just sit there and they kind of wallow in self-pity and they don't take action, they don't get moving, and they're not even starting yet. They haven't even signed up for the marathon. And then the second group are those that get into momentum, those that know what the problem is, and they actually do something. As soon as they know that it's plantar fasciitis, or they know it's a stress fracture, or they know it's a plantar plate tear, they do something. They sign up for the runner's heel pain course, or the plantar plate course, or they get a treatment plan from their doctor. They start doing the things that they know are going to help make it better. But they have to do both. You have to get started and you have to get into momentum the same way that you have to sign up for the marathon. And then you actually have to do the stuff that builds on your fitness all the way up to the time you get to the starting line. That's the only way you can do it, to do it quickly. But it's those two things. So what it really comes down to is that you've got to make sure that these two things are working for you the same way they work for your marathon. Now, the truth is that training for a marathon is a lot simpler because all you have to do is sign up and then get up the courage and the energy to actually do the things to take the next step. The people who have running injuries get confused because they don't really know what to do most of the time. They post something on a forum and get 20 different kinds of advice about 20 different kinds of conditions, and then they're just sitting there with sort of this analysis paralysis where they don't know what to do. They're looking for more and more information, but they're not making any progress. So remember, you got to get started. You got to get into motion. So if you want to know how to do that, go check out the 12 steps. It'll walk you through the process that I use so that you can use the same sort of marathon method of your injury recovery so you can get back to training, get back to running, stay fit, and get back to running faster. Go check it out. I'll see you in the training.
Doc on the Run. We help injured runners run.